Necrotizing fasciitis. Although many may hear that an infection like necrotizing fasciitis works quickly, this may not be something fully comprehended. Infections that come into direct contact with an open site of trauma can seep into the body almost immediately, then developing at a general rate based on a few factors. In particular, the type of infection tends to govern how fast it will spread. Whether the patient receives proper antibiotic treatment is also a major factor. With regards to necrotizing fasciitis, symptoms may appear the first day the infection begins. From whatever cause, the bacteria enters into the body through a wound or burn. Within the first day, the pain around the injury will grow steadily. Eventually, the pain around the wound can actually seem disproportional to the injury itself, which may have even been minor. Although usually around the injury, this pain can occasionally develop in nearby areas. As time passes, the pain becomes more intense. Eventually, diarrhea, vomiting, and a fever may set in. If left untreated for 3 or 4 days, the infection will progress steadily. Most of the infected area will change color, taking a purplish tint. The skin will swell up, possibly feeling hot when touched. Eventually, these areas may begin to blister. As the skin continues to die, blisters, filled with dark fluid, can appear as a last sign. At this point, enough of the tissue may be dead to make the affected area appear dark, whitish, or even a shade of blue. The skin can also have a flaky texture. Over the next few days, the bacteria's toxins may become widespread enough to trigger toxic shock within the body. As the infection continues to spread, patches of skin will continue to go through the process of swelling, possibly blistering, and dying. Once toxic shock settles in, the injured individual may slip into unconsciousness while their major bodily systems undergo severe damage and irregularities. Without treatment up to this point, the shock alone can claim a person's life. While these infections can be contracted almost anywhere, when a person contracts one in a hospital, it is especially unforgivable. If you have suffered a serious infection due to unclean conditions in a medical facility, you may deserve compensation for your losses.